Thank you, Peter. At this time, I'd like to turn the meeting over to Dr. Raynard Washington, Mecklenburg County Public Health Director. Dr. Washington.
Thanks a lot. Much appreciated. And thank you all for joining us this afternoon for a brief update on monkeypox. I think this will be a fairly quick update, but I want to first pass it to Joy Smith, our Communicable Disease Director for Mecklenburg County, to give a quick update on where we are with cases in the county.
Hi, everybody. We just wanted to let you guys know that currently North Carolina is reporting 27 cases of monkeypox. This does differ than what the information that's published on the CDC website, but we are able to confirm that North Carolina is reporting 27 cases, and Mecklenburg County has 18 of those cases in our county. That is our numbers update.
Perfect. Thanks, Joy. Appreciate it. And generally speaking, the demographics continue to follow the pattern that I described last week when we met. So I won't go back over that pattern in terms of the epidemiology of who's most impacted. The main purpose for our update today is to provide an update on vaccines. We did receive an additional allocation of vaccine from the state via the federal government. So we did receive an additional 720 doses of vaccine last week on Friday, I believe, which is now available to folks in our community for who are at greatest risk for exposure to monkeypox. In addition to the new vaccine that's been delivered and available to us, the state issued guidance on Friday that we now expand our eligibility criteria beyond the groups that I described earlier. It's a very small expansion, but it is important for folks in the community to be aware of this expansion. And so I'll just review the groups who are eligible for vaccine as of effective today. So the first group, and obviously the most critical group, is anyone who's come into physical close contact with someone who's been diagnosed with monkeypox in the last 14 days. And those individuals obviously are being identified via contact case investigation and contact tracing. But of course, if anyone is self-identified or is told that you've been exposed to someone with monkeypox, either here in Mecklenburg or outside of in another jurisdiction, please notify the health department immediately and you are eligible for a vaccine. The second group are anyone who identifies as a man who has sex with other men or transgender individuals who report any of the following in the last 90 days. Again, 90 days is different. This was 14 days previously. Having multiple or anonymous sex partners, being diagnosed with a sexually transmitted infection of any kind, or receiving HIV pre-exposure prophylaxis or PrEP. So again, any MSM or transgender individual who report any of the following in the last 90 days, having multiple or anonymous sex partners, being diagnosed with a sexually transmitted infection of any kind, so that includes syphilis, gonorrhea, chlamydia, HIV, etc., or individuals who are receiving HIV PrEP and identify as men who have sex with men or transgender individuals are now eligible to add themselves to the wait list for a monkeypox vaccine. This represents a transition to more of a prophylactic approach in terms of vaccinations. We recognize fully that we still have well over 600 people on the wait list here in Mecklenburg County. So we are going to be offering appointments for the new vaccine to individuals on our wait list on a first come, first served basis. I encourage individuals who are now eligible because of this expanded criteria that the state has released to go ahead and add their names to the wait list as well. As of this morning, there are about 688 individuals on the wait list here in Mecklenburg County. That includes our residents, but also residents in this region. Most health departments around us are not administering vaccine, and so we're the closest one for quite a ways. I think Forsyth is the next closest. And so we are serving not just Mecklenburg County residents, but folks across the region. So if they meet those qualifications, again, I encourage them to go to our website or call the hotline to add their names to the wait list. The next update and the next and final update I have relative to the vaccine rollout is that we've also been given guidance by the state to no longer reserve second doses and only administer all that we are allocated as first doses in an effort to expedite vaccinations. as well as to make sure that we're doing everything possible to work towards containment. And as you all may know, this is a 2-dose series, and so it's 1 dose and then a second dose 28 days later. And we had been previously reserving doses for those individual second doses, but it's been communicated to us that that we will have vaccine in 28 days for individuals to receive their second doses, or at least close to there. And so we should go ahead and administer the doses we have on hand. And so we are making additional appointments available through the scheduler today, which will basically, it won't be open to the public because we're working from the wait list that's already very long. And so we're going to try to get as many of those folks into our clinics over the course of the next 2 weeks, or shorter order, as quickly as possible to get through the vaccine allocation that we currently have. For individuals who've already received their first dose from the Mecklenburg County Public Health Department, we are continuing to retain those individual second doses so that we can ensure we have vaccine for those individuals in about 2.5 weeks. I think this is the earliest that folks will be coming back in for that. But for others, we will schedule your appointment for the second dose at the time, but we won't keep that dose in the freezer because we need to move as quickly as possible to get the vaccine out to folks. So those are all of my updates for today, and I'm happy to take any questions.
First question today is Brett Jensen, WBT Radio.
Hey, Dr. Washington, sorry if my internet is a little spotty. Real quick, in terms of what you guys are seeing in terms of symptoms and what's happening, since now it's becoming more prevalent and you're getting a better understanding and can see it firsthand, is everything pretty much still the same? Long-term firsthand, more severe than chickenpox, but the symptoms last a little bit longer, but still not fatal and stuff. I mean, is everything pretty much what it was?
So, Brett, I think I got most of that, and I'll go ahead and pass it to Joy and let her sort of chime in on sort of what we're seeing in terms of the cases that we've talked with, and we've talked to all of them.
Yes, and so we're seeing our cases with pretty mild symptoms, but yes, the same symptoms that we've discussed. We do follow them out for a period of 21 days, so there's still stuff to learn, but that is what we are seeing.
And I guess, I'll comment too, relative to the urgency of the situation, beyond the current cases. Again, they're all been adults, but of course, everyone's at risk for monkeypox infections. And so for some people, we know the infections can be more severe, specifically children, as well as older adults, people who are immunocompromised. And so that's why we're so laser focused on trying to contain community transmission, so that we don't get to a place where we have those folks who are at greater risk of being really sick. And, in some cases, for example, kids who are not eligible to be vaccinated without a special approval, we're able to avoid transmission or exposure to those individuals.
Next question is Ashley Mahoney, Axios, Charlotte.
Good afternoon. Thank you for your time, Dr. Washington. I apologize, my internet cut out earlier when you mentioned the number of doses that were received on Friday. If you could verify that number again for me.
Certainly. So we received 720 doses from the most recent application.
Okay. And when is the next round of doses set to arrive?
Excellent question. I don't have a definitive answer to. We have been receiving them sort of on a weekly basis at this point, but the next phase is when the CDC shifts into what I think is being called phase 3. So I don't know the exact timing of that. It may be as early as this week. It may be next week. I'm not certain. So we'll certainly keep you all posted. I have not yet received an allocation or an allotment from the state or an estimate of a delivery. So when we learn, we'll keep you posted.
And that 720, is that the total number that the county has at present, or that was strictly the amount that was brought in on Friday?
That's strictly the amount that was brought in on Friday. I don't have the exact number of how many doses are in our freezer right now, but I can tell you that we have administered almost all of what we had received previously based on, allocating first and second doses. And our team right now is working to schedule appointments from the wait list that we have for the new 720 that are now available to us.
Thank you. And just a quick follow-up, if I may. In terms of big picture, the number of vaccines that the county estimates it would need as a whole, is there a ballpark figure for how many the county needs?
It's a really difficult question to answer because it requires us to have a better understanding of specifically the population at risk. And while we have some estimates of the number of people who are actively on PrEP, for example, or estimates of the number of people who've had an STD in the last 90 days, that number is still something we're working to produce a reasonable estimate that could be used as a target, I guess, if that's what you're asking. So I don't have a number today of what we would need, but I can guarantee you it's more than we have to date received roughly 1,300 doses, so it's more than that, and probably a lot more than that. So I expect today's announcement will certainly increase our wait list, and demand will continue to go up as more people are eligible. And so we are working to advocate for obviously as much supply as possible, given the way the outbreak is escalating here in Mecklenburg County.
Thank you.
Next question is Vanessa Rufus, WCNC.
Hi, I have two main questions. So I'll start with my first one. Have you gotten any cases that have been spread via respiratory droplets, from which I understand is possible, but a little bit harder to do?
Hi, from our case investigations, it looks like all of our cases were spread via close or intimate contact, not via respiratory droplets.
Okay, and then my second question is, I've been seeing the past couple of days several high-profile doctors take to social media saying, if this becomes endemic, this is going to be one of the biggest medical travesties that we've seen in recent years. Do you have any concerns that this is on track to being endemic at some point? Do you feel like we're doing enough to prevent this from spreading further? I guess, what is your viewpoint right now on how we're handling this and whether more needs to be done, either from a federal level down or any other way?
Yeah, Vanessa, great question. I think in general, what I would say back to that is, right now we've got to be laser focused on trying to avoid widespread community transmission, particularly in areas of high impact. And so given that we have a limited supply of vaccine, which is a very effective tool to help us prevent community transmission by vaccinating those who are exposed or at great risk of being exposed at some point in the near future, that is the greatest limiting factor we have right now. And I know our federal partners are working to procure as much vaccine as possible and to get it distributed out to states who then can distribute it out to local health departments and other partners. So that's certainly a limitation. I'm very pleased with where we are with testing capacity in the county, state, and country. I think we definitely have some ways to go with education among providers. We locally started our education efforts about 2 months ago when this first started in the country because we wanted to make sure we were prepared. And I'm very proud of our team for working with our provider community to provide education and to make sure we were communicating. That being said, we've got to reinforce those messages from 2 months ago and even 2 weeks ago because it's becoming more prevalent and our incidence is going up locally. And so more people are being impacted. And what we don't want to happen is folks to not seek care or not be able to identify or find a provider to get testing at. And so we need our provider community support. We need all those sort of players, our health systems at the table as well, which they are, to assist us in the testing process to make sure that we're identifying cases quickly, isolating them, and making sure that any close contacts are vaccinated to avoid any further transmission. So that's our focus and our goal. And I think locally, we're certainly doing what we can do on that front, as well as on the outreach and education front. And really why I'm doing this today, and we will keep doing these as needed, is also relying on our media partners to get the word out to the public, to look out for signs and symptoms, as well as to know who's available, who's eligible to be vaccinated, as well as encouraging folks to get tested if they're experiencing symptoms.
I just have a quick follow-up, if I could, regarding the education and the steps that y'all have taken to kind of push this information out. I guess this would probably be from an anecdotal standpoint. Have you found that the folks who have come in with these infections to you, were they aware that this was going on, and so they were able to say, "This is it. I think I have monkeypox," or do you find that there are still people who have come in infected and they still don't know that this is going on?
Vanessa, it's kind of hard to say that at this point because, again, most of the mode of transmission has involved, in most cases, sexual contact. And unfortunately, we've also had some incidences of co-infection with other infectious illness, STI, with other infectious illnesses that are sexually transmitted. And so people are experiencing symptoms and think something's wrong. But sometimes the symptoms can be misperceived as, like the pox could be perceived as like a syphilis sore or something else. And so I think certainly there is always an opportunity to do more in terms of education and outreach. Our teams were out last week at Pride events, as I mentioned last week, and we're continuing to educate through partners and our staff directly. But certainly there's definitely more awareness that could be raised around looking for signs and symptoms, and also making sure that people don't misbelieve that a rash is a benign rash, especially if you're in that high risk group and you've had those high risk contacts.
Thank you.
We're going to circle back to Peter Floyd, our translator, and see if our Spanish speaking media have any questions at this time. Peter?
En este momento queremos preguntar si los medios de comunicación hispanos tendrían alguna pregunta para hacer en español en este momento.
All right, thank you. We're going to continue with Kari Beal, Spectrum.
Hi, thanks so much for joining us today. I had a question. We cover news across the entire state, and just looking at the numbers, it looks like it's much more serious here than most other counties. Is that a correct assessment? And what would you like to say about our county, considering we have so many cases here compared to others?
Certainly. Yeah, I mean, I think based on what our counts are, roughly 2/3 of the cases are here in Mecklenburg County that have been confirmed in the state. I will say we're still very early in the outbreak, meaning that there are possibly other cases in other jurisdictions and areas that have not yet to be identified. But certainly, obviously, it's having a disproportionate impact in Mecklenburg County. I believe, obviously, we're a more densely populated county, and obviously we have the largest city here in the state. And so certainly we are working quickly on the ground here with our partners to be as proactive as possible, given that there's so many cases here locally. Again, I will reemphasize that we have been successful at tracing all of our cases to known cases, mostly out of jurisdiction, which is helpful and at this point, a positive sign in terms of there not being any evidence of local transmission. But that is very fragile in terms of how long that will be the case, as we have more cases coming in and out of the county, either because folks live here or they're visiting here. And so we've got to take every step possible now to vaccinate those at risk, and get the message out to folks around the risk that's there and adjusting their behavior as appropriate to avoid exposure.
Great, thank you.
Sure.
Next up is Amanda Harry with Q City Metro.
Hi. All right. So, just sort of following up on how monkeypox is commonly transmitted through, as y'all were saying, close contact and post-intimate contact. Would you say that this disease classifies as an STD?
No, it is not. It can, it is transmitted. I'm sorry, I should let Joy answer this. But Joy, do you want to answer? My screen is off. I can't see you. Okay, well, I'll just answer. I can't see Joy. No, so monkeypox officially is not a STI or a sexually transmitted infection. It is transmitted by close personal contact. Close personal contact occurs when people are intimate or having sexual contact. And so it's actually the contact with a pox on someone's skin or their bodily fluids, both saliva and otherwise, that are the point of transmission. So this will not be classified as a sexually transmitted infection because you don't have to have sexual contact to transmit it.
All right, thank you. And so just building off that, what are some other myths surrounding this disease that you have seen coming through from your end of things? Like other things that people may believe of monkeypox that are kind of being spread through hysteria and whatnot.
Yeah, so I don't really have sort of a list of myths that we're trying to dispel. Certainly, I think, as I've talked previously, this is not, there's this notion, I want to be very cautious with stigmatizing this as a disease of folks that's only impacting people who are men who have sex with men. For example, that is important to note that anyone's at risk, including females, adults, everybody's at risk, children, because it's spread through close contact. And so I think that's important. Also want people to know that testing is available, not just at the health department, but in the community. And so you can go to your provider and ask about testing. And if they are not able to do it, they should be able to refer you to someone within their system. Or, of course, ultimately, the health department is here and available. And then lastly, I guess I would just note that monkeypox is its own virus. It's different than chickenpox and smallpox. It does not spread as easily as something like COVID, but so it's not as much of a public threat in that regard. But it is rare in the U.S. And so the current levels of transmission are, of course, concerning for all of us.
All right, and I apologize if you mentioned this before I got on, but can you just share once more again, with the disease being, if everyone is at risk for it, can you share more about the high risk group of people? I think you mentioned earlier that there is like a high risk group of.
Sure. Joy, you want to talk a little bit about the risk profile we have locally?
Yeah, so what we have seen, and I think this is the same pattern that's seen across the state, is that Black men who have sex with men have been affected. And we have also noticed, and I think the state has noticed too, that these are not the persons that we've seen in our vaccine opportunities. So we would kind of like to stress and offer that and make sure that they present for the vaccine offerings. And also, not in North Carolina, but data that's preliminarily available in Tennessee, I believe, is that Hispanic males have been disproportionately affected. So we are trying to get some messaging out to get those persons of color, MSM persons of color, in for vaccination.
Got it. So just to clarify, you're seeing more infections among Black and brown men that have sex with women than you are seeing in the vaccination rooms.
Yes.
Okay. All right. Thank you.
Next question goes to John Paul, WSOC TV.
Yeah, thanks for taking the question. I'm curious, the most recent vaccine push we've seen obviously was with COVID, and we know how all that went and the big push there. Do you foresee a day, or are you planning on doing any sort of mass public vaccination for this? Are those things being planned at all for the future?
So great question. And certainly we have playbooks for mass vaccination events that are ready to be deployed as needed. The problem we have right now is we simply don't have adequate supply to even consider having a mass vaccination event. And so until our supply increases and is stable in some way that we can project out how much we'll have and when we'll have it, it is important for us we're obviously going to continue to take the approach that we're taking. But in the space where we start to have broad community transmission, or certainly the cases continue to escalate here or across the state, I think we'll be in a position of having to consider broader vaccination activities. And I think once vaccine supply is available, but again, the limiting factor here is vaccine supply. And so until we have the supply, we really can't. And we are monitoring very closely the folks who are coming into the appointments that we have available now, and looking at obviously equity in that work as well, to understand sort of who's being vaccinated and how that lines up to the risk profile in the community. And so we're making sure we're trying to make those at highest risk get in as quickly as possible.
Now we're going to circle back to Ashley Mahone. Mahoney. Ashley.
Yes, and just to clarify, you mentioned that testing is available via the county as well as individual providers, but vaccination, again, correct me if I'm wrong, but vaccination is only available through the county. Providers cannot do that at this time.
So there are a few providers that we've transferred vaccine to specifically to support patients in their practices who are known to be high risk. So they are not making those appointments, quote unquote, publicly available, and it's a very small allocation of what we received in total. And so we are working with, again, just a few select providers who commonly or regularly serve risk patients within their units or practices. But in terms of the public access, if you were not specifically being served by one of those providers, you are certainly able to add your name to the wait list for the health department and schedule an appointment with us. We are expecting in the future, of course, to bring on more providers to be able to administer vaccine as well. But that is that is dependent on availability of supply. And we don't want any vaccine sitting in a freezer in a situation where we're trying to respond rapidly. So we want to make sure it's getting out as quickly as possible. So we've got to work strategically with partners who are able to help us in that process and also make sure that we are serving people who are there's some fairness in how people are being served. So the more you spread it out, the more, it becomes that we saw with COVID where we're going here, there, and everywhere, and it just creates a little bit of confusion. And for right now, we only have enough to serve such a small number of people. We're able to help coordinate for the region here at the department.
So at this point, it is the best bet people can move forward with is sign up, get on the wait list, and then just wait until your number's called, basically.
Yeah, and we're working quickly through the wait list because again, we want to be good stewards of the vaccine that we have here in the county. We don't want to have it just sitting. And so even last week, we had communicated with the majority of the people on the wait list to give them an opportunity to schedule one of the appointments that were available. And so our team is working quickly, and we've added to the hotline team just to make sure that we're able to get through we're filling spots as soon as we're able to open them. As well as increasing our nursing capacity in the clinic to make sure that we can have as high a throughput on a daily basis as possible. So we're doing what we can to make it as simple as possible for folks. And of course, today's announcement is probably going to make our demand go up quite a bit. And so we're prepared for that increased demand over the next several weeks.
Thank you.
Next up is Vanessa Rufus.
Hi, thank you again. I wanted to see if we could go back to the concept of the stigma. And is there a way that you could how would you message to the public why this is impacting a certain group of people in our community, but it is not specific or unique to the demographics you mentioned?
Yeah, Vanessa, it's a great question. And I talked a little bit about this last week, but that balance is really important. So I don't think we should ever be reporting on monkeypox to the community without talking about both sides of the balance, right? And so one side of it is it's important for those who may potentially be at greater risk of infection or exposure because of the groups that are being more heavily impacted right now. It's important for people to know. It's important for that community to be aware that it's disproportionately impacting them. And because this can be transmitted while people are engaging in sexual activity, it's important for people to have that information so they can make informed decisions about the risk associated with it. And they can also ask questions. They can ask their partners, have you been exposed or do you have any signs and symptoms? And they can, potentially adjust even their decisions to either have anonymous sex or to not. All those kinds of things, they can make informed decisions. And so I think it's important to highlight for those groups the risk and that they're at greater risk. At the same time, that risk spills over to everybody because this is not exclusively shared or transmitted sexually. And so that individual, whether or not if you're a young Black MSM in Mecklenburg County and you are exposed to monkeypox and you have it, you've still got to go to work, you've got to go to school, potentially you've got to go to your house of worship or around your family. And so that risk could then be transmitted to someone else or because, you've been exposed. And so I think we've also got to communicate. We don't want people walking around thinking, oh, I'm not a young Black MSM, so I'm not at risk. So we've got to make sure we keep that balance. And so I ask you guys, if you tell both sides of the story, when you're communicating to the public, it will help us to be able to make sure that we're not feeling one-sided, we're not creating a stigma. And the source of this is all because of social networks, right? It's all about how people engage with one another, right? And so you expect something that can be transmitted sexually to impact the groups that are having sexual contact with each other. And it's just all about where it started in terms of how this outbreak got started in the country. This could have very well been a different a different group of risk, a different group of folks, right? It could be heterosexual white men. It could be a whole different group of people, but in fact, because of the way the outbreak got started in the state or in the country, that's the group that's most impacted because that's the group most at risk because that's the group that's going to likely have sexual contact. So there was a lot to say, but I do think having both sides of that balance presented to the public will help us with communication so people can assess risk and understand the severity of this for their own individual lives.
Yeah, I think that was an important explanation. My quick follow-up is, do you fear, like, for example, with other viruses that we've seen in the past, people won't take it seriously if they think it only pertains to a certain group?
Yeah, absolutely. I think that's been one of at least what I've heard anecdotally around criticisms about talking about the MSM community is that people have this unrealistic thought of the protected because they don't fall into that category. And so I think it's important. And I guess also we haven't spent a lot of time emphasizing the groups who are at greater risk for severe complications. And so when I think about kids and I think about older adults and people who are living with HIV, or other immunocompromising conditions, it's really important for those groups to think about, okay, have that information that they could potentially be at risk. And while our case counts are really low right now, and we're doing a great job at isolating folks and tracing contacts, that could grow really quickly in a short order. And so we're trying to just be as proactive as possible with our messaging, and certainly want to make sure people are aware that monkeypox is here, and that it is not, it's not COVID all over again, but it is an important public health issue that we've got to deal with.
Thank you.
Thank you. At this time, we're going to check back with our interpreter, Peter Floyd, to see if our Spanish speakers have any questions at this time. Peter?
En este minuto se invita al público hispanohablante a hacer preguntas en español. ¿Alguien tiene alguna pregunta que quiere hacerle al doctor en español?
Thank you, Peter. Next up is Amanda Harry. Amanda.
Thank you again. Can you just share a bit more about why at the moment the availability for vaccines is as low as it is? Are you saying like do you foresee there to be, continued problem with, high demand, but, low supply?
Yeah, so the long and short of it is monkeypox, of course, is not common in the US. It is not, it is, of course, endemic in some countries in the world, but not here in the US. And so because of the rareness of it, we do not routinely vaccinate against it. And of course, these vaccines are designed for the family of viruses that monkeypox belongs to, and as well as smallpox. And so the long and short of it is because we don't use it, we don't have as much of it available. And so the federal government keeps in the national stockpile a certain amount of it. And so we're currently using what's been put on a reserve in the national stockpile for emergencies just like this. But there's a limited amount. So there's not as much as we might have like for other infections that we routinely vaccinate against. And so that's why you heard me say earlier, our federal partners are working on our behalf with the manufacturers of the vaccines, specifically Jynneos, to ensure that they can procure more of it so they can then distribute it to us to make available in the community. So this is just I don't want to call it's not supply chain, but they have to buy more than what we currently have available. So they're emptying out the stockpile. Maybe not emptying, but they're pulling from the stockpile with the intention that they will be able to procure more in the future.
Okay, and I just want to briefly revisit. I know that you mentioned how the symptoms are similar to that of syphilis and similar diseases. Are there any other specific things that people should look out for with monkeypox that they can identify it and know that it's not something different? Like anything very specific to it that can sort of let people know what they should get vaccinated for or treated for.
Sure. Joe, you want to take that?
Yeah, so one of the things that characterizes or is different from monkeypox versus smallpox and possibly some of those other diseases is the lymph node involvement. So if they have a rash or one of the other symptoms and also notice that their lymph nodes are swollen, that is something. And also we're just encouraging people to kind of keep in mind, at first we were thinking about those areas where there were cases, if there was travel there. And also if they have a partner or have been in close contact with someone who might have had similar symptoms. So those are kind of some ways we'd hope people would be able to distinguish.
All right, thank you. And just the last question I had is just what does the process for testing look like? Like what can someone expect when they come in to get tested for monkeypox?
Yeah, so when someone is tested, ideally, they will have a lesion in the stage that will allow the provider to be able to kind of rub against that lesion, maybe abrasively, to get a sample. And there are 2 dry specimens collected and sent off for testing. So at this point, that's the method of testing that's being used.
Okay, thank you.
The floor is open for follow-up questions. Any follow-up questions today?
I do have one. I'm sorry.
Go ahead.
I know we mentioned it's really rare, but could you explain a situation where it could be spread by respiratory droplets?
So, Vanessa, I think it's very difficult for us to specifically isolate in every case all of what may contribute to transmission because particularly most of the transmission that's occurred, there's been evidence of sexual contact. And when you have sexual contact, there's physical skin contact, there's often potentially kissing and other kinds of actions happening that's exchange of bodily fluids. And so it's very difficult to isolate which of those interactions during that interaction created the transmission. From what we know in terms of evidence that's currently available, if the person's not having that kind of contact, meaning no sexual contact, there is still the potential for transmission if they're in the space with that individual and a close physical contact again on a couch, laying together, other things that may not involve sexual contact for extended periods of time. And so I think that there, again, with all of our so far cases having that sexual contact, it is very difficult to isolate a situation. And Joy, if you want to add anything to that, I'm happy to.
And then I guess less likely would maybe be a healthcare setting, whether there was some kind of respiratory test being performed and the proper PPE wasn't being worn.
Yeah, and at this time, we're counting people who live with cases as close contacts because, of course, again, for that very reason of not being able to isolate how much time you spend with the person and those kinds of things, it's important for us to take those precautions.
Thank you.
And the floor is open for any more follow-up questions.
I have one. I know you mentioned earlier that despite Black and brown men being the most at-risk group, they are the least vaccinated. Who is currently the demographic you're seeing getting the most vaccinations for monkeypox?
I believe Joy was referencing sort of national data. Here locally, I have to take, she was talking about nationally, not necessarily our local experience. I have not actually seen it today for the most recent numbers of where we are, but I'm happy, Amanda, to provide that to you as a follow-up. I definitely know from my prior looks that we certainly were having a very diverse group of folks come in for vaccines locally, but that was based on data from earlier last week, so I won't quote a number or percentage, but I'm happy to provide that to you as a follow-up if you just send us an email.
Okay, perfect. Thank you.
Sure.
Any further follow-up questions today? I'm going to ask Peter Floyd, our Spanish interpreter, to see if there are any questions from our Spanish-speaking media. Peter.
Nuevamente se abre el micrófono a cualquier pregunta que alguien tuviera en español para que sea interpretada.
All right, thank you today for attending today. We also like to recognize our American Sign Language interpreter, Meg Tucker, and our Spanish interpreter, Peter Floyd.
Thank you all so much. Have a great day.
Thank you.